I believe we are ready to begin. Good afternoon, everyone. Thank you so much for being here. We are incredibly excited to announce the opening of the Fox Cities COVID-19 vaccine clinic. Tonight we'll have a few speakers, and then after each speaker, we'll open the floor up for questions. And after questions, the media is welcome to tour the clinic behind me and do any sort of breakout interviews if you'd like. Speaking tonight, we have Appleton Mayor Jake Woodford, Outagamie County Executive Thomas Nelson, Appleton Public Health Officer Kurt Egebrecht, Outagamie County Public Health Officer Natalie Vandeveld, and we have Dr. Tom Nichols, VP of Medical Affairs for Ascension St. Elizabeth, and lastly, Dr. Jennifer Frank, Chief Medical Officer of Theta Care.
Good afternoon, everybody. I'm Mayor Jake Woodford from the City of Appleton, and first of all, I want to thank you for being here this afternoon to tour this new asset for our communities here in the Fox Cities, and to help get the word out about another point of access for COVID-19 vaccines for our communities. I think it's fitting that this clinic is located here at the Fox Cities Exhibition Center, as this facility was built by all of the Fox Cities communities. And so this is a shared asset. The building itself is a shared asset, and so is this clinic. And I know that this has been, the vaccine rollout has been frustrating for so many across the country, and certainly in our community. And I've heard from members of our community in the city of Appleton and neighboring communities who've been frustrated about where to go to get a vaccine, where to sign up, and worried about how they're going to access this critical resource. And this clinic provides clarity for our community, and it provides an opportunity to access the vaccine, and we're so pleased to be able to be a part of hosting this clinic. I also want to express gratitude to my fellow municipal leaders in the Fox Cities for their support of this work. And I also want to thank the Red Lion Paper Valley Hotel and Linda Garvey and her staff. Thank you, Linda. They have done tremendous work in support of getting this clinic up and running. They had done tremendous work to get the facility back up and running when we were operating testing out of this location. And we are so grateful for the partnership. One of the reasons that it has taken us a little bit of time here in the Fox Cities to get this clinic up and running is because of our approach. And our approach has been about partnership. And you'll see there are agency logos and organization logos on the boards around the hall, and I hope you take a moment and look at that. There are so many partners involved in making this happen, and it really is a testament to the strength of our communities and the willingness to band together to work across our differences. It's not always easy to collaborate, but we are so fortunate to live in a community where people want to work together in the interest of the common good. So with that, I just want to thank you again for being here and helping share the news about this new opportunity for our communities, and look forward to taking your questions. Thank you.
Well, welcome, and first of all, I want to thank Mayor Woodford for his leadership, work, and helping us get this going. And he had talked about how we take a different kind of approach here when it comes to the Fox Valley. You turn on the TV, you open the newspaper, there's just really not a lot of good news. Just today in Madison, there's a lot of that business going on. Washington, the same thing. But here in the Fox Valley, we've got something special going on. We have, 4, 5, 6, 7 jurisdictions that anywhere else I think would be really difficult to get together, pushing in the same direction. That's not the case. Here, we have terrific leaders at the local level, city, county, hospital, public health, that can get together and take on an issue like this, a pandemic that we have struggled with for almost 10 months. And I think what you see right now, the fact that we've got this site because of the hard work of our public health departments, with Natalie and Kurt and all the support that they had, this would not be possible. There's a lot of work that goes into this. We need a lot of support. And I just want to say thank you for all the work that they've done to make this possible, and know also that this indeed is a matter of life and death. We have got to get vaccines into as many of our constituents, as many people as possible, and as quickly as possible, and as efficiently as possible. And we have already set up, this is a good operation. In fact, I predict that this is going to be a model operation that they're going to use across the state, and perhaps across the country. So I'm very proud of everything that everyone does, and thank you for coming. Thank you.
Well, I too would like to thank everybody for attending today, and this is actually a very exciting day for all of us. This is a culmination of a lot of work, and it's turning the page. It's turning the page for our residents to know that there is a positive spin in 2021, where we're going to have an opportunity to knock this virus down through vaccinations. So you've heard it a lot, but I just also want to reiterate the collaborations and the cooperation that I think is quite unique to the Valley. And you're going to hear from two of those healthcare system leaders later, but I want to also recognize other partners that have stepped up throughout the Valley, and that includes Mosaic, Akana Clinic, the Partnership Clinic. We have listed those, as you heard earlier, on the marquee, but there's still a big tent available, and we're looking for more partnerships, and we're looking for more community members to get involved. This is just a start, and next week our target is to vaccinate 1,000 people, and I'm confident we'll do that, but we feel that's just the beginning, and we really see this as an ability to gear up as more vaccine becomes available, and that requires a continuation of support within the entire community. And that's what we expect, and I'm just so proud of those relationships that are established. I do want to touch a little bit because inherently there's going to be frustration next week and moving forward in the next coming weeks, and I think we want to set expectations, realistic expectations. Vaccine is in short demand across the country and will be for some time. So our target is actually our allocation that we'll have. We won't be able to exceed 1,000 doses. We recognize we'll have more people that want doses than we have. I ask the people to please be patient. We will certainly add additional clinic dates and opportunities as vaccine becomes available. But part of that partnership and part of our planning, we really wanted to work together in a way that we talked about who do we want to target in this first go around and the first weeks within this clinic at this particular location. And what we really did is to look at the local data. We looked to our hospital leaders to provide who unfortunately has died of this disease and who's been hospitalized. And so we really are asking the public to understand that our target for this group early on is going to be those 65 years and older. We won't take appointments or provide vaccine outside of this group, and that's purposeful. We know we won't have enough vaccine, but there's a recognition that this is the group we want to reach because they are the most vulnerable. So please be patient. Please understand we're going as fast as we can, and we will continue to do that. And I just thank everybody for being here and being a part of this special day.
Good afternoon. I wanted to focus on the collaboration that is here in the Fox Valley and what I experienced with my agency, Appleton County Public Health. And we're excited to support this partnership that is currently present at the Fox Cities Vaccine Clinic here at the Fox Cities Exposition Center. As vaccine is administered in Wisconsin, we are encouraged that this site will support the community vaccination, beginning with individuals 65 and older. Outagamie County Public Health, in addition to the broader Outagamie County organization, will continue to share resources, collaborate together to find efficiencies that this clinic will best service the community. We are encouraged that this vaccination clinic will continue to serve the community and look forward to opening next week, Tuesday. Thank you.
Thanks for having me. For the past year, Ascension has been focused every day on how we can support the healthcare needs of the community and how we can support our frontline staff and associates as we navigate this pandemic. And early on in the process, we had conversations with ThedaCare and the other health systems in the area and decided we were not going to let competition stand in the way of cooperation and meeting those challenges. And this is no different. So we have been working with Dr. Frank from ThedaCare, with Kurt from the Public Health Office, and with the other health systems in the area on how we can rapidly ramp up our ability to vaccinate all the members of the community of the Fox Cities. We've already started that with the Group 1A through our vaccine clinics at the Ascension hospitals in the area. And we're excited about being able to roll that out now to the Group 1B people that were discussed earlier. We are also vaccinating patients 65 and up, along with those Group 1A members through our Ascension hospital clinics. And those eligible for that vaccination will get notified by text, email, and phone calls that they are ready to come in and receive that vaccine. The response so far from the community has been overwhelmingly positive. People are excited about this vaccine. People are seeing that light at the end of the tunnel and knowing that we're getting closer to the finish line. And I want to thank the people of the community for staying together throughout this time. There's been incredible sacrifices that people have made, incredible losses that people have experienced, but we've continued to stay together as a community. And if we can continue that for the next few months, we'll be able to get through this vaccination phase. I also want to thank Kurt from Appleton Public Health. He and I had a conversation last night and said, let's dream big for this clinic. Let's not let any barriers get in our way of reaching as many people as we can, as quickly as we can. So we have a lot of people here that are willing to work around the clock to do what's necessary to meet those goals. Thank you.
Good afternoon. On behalf of ThedaCare, I am really very excited to take part in this community initiative. Like all of the other speakers have said, we are stronger together, and we live in a unique community where our commitment to the good of our community is stronger than our commitment to any of our individual organizations. And as a result of that, we see the success of a clinic like this and ongoing success as we begin the challenging process of immunizing our community members. While the vaccine is new, giving vaccinations in a safe, efficient manner is not new to ThedaCare, Ascension, and other organizations. We are asking for your patience and understanding as we really focus on immunizing and vaccinating our most vulnerable members, the people who are highest risk for death or hospitalization from COVID. We know that there are a lot of questions about distribution, when vaccine will be available, and we are following all federal, state, and local guidelines to make sure that we are distributing in conjunction with those guidelines. As vaccines become available, we will be updating our patients and our community to make sure that everyone who is eligible for a vaccine can get one. Within ThedaCare, we are asking that our patients do not call our offices directly. Much like Ascension, we are reaching out to eligible patients, primarily through our online portal, My ThedaCare, which is available to any member of the community at thedacare.org. And we will be reaching out with an invitation for vaccination, and we will continue to expand those invitations as our supply, which is governed by the state, becomes available. As the pandemic continues to affect us in this community as well as worldwide, we know that the vaccine is critical to stopping the spread. As we wait for all of us to get our vaccination, it is essential that we continue to wear masks, practice social distancing, and wash our hands. Widespread vaccination or community immunity for COVID represents our best opportunity to reopen our community, to revitalize our economy. Thank you very much for the opportunity to participate.
Thank you to all of our speakers tonight. We'll now open the floor up for any questions that the media may have.
I think what people want to know is, I know it's only going to be open to people 65 and older, but how do people sign up? And I know there's something mentioned about that Theta Care essentially will be sending out invitations to people, but there's also people that maybe don't have healthcare providers in the community or that are less privileged, that might not have healthcare. How are they going to get the vaccine? And how do people going to get access to this? That's what I think a lot of people want to know.
Kurt, yeah.
Thank you for that question. And as we said at the start, there is going to be limited vaccine. And what we're trying to do, again, is to target people that are in the Tri-County area, Outagamie, Winnebago, Calumet County, to utilize this as a regional center. With that limited vaccine that we have, and with the staff capacity, the most efficient way to enroll people will be online. There'll be an opportunity tomorrow morning with that website that will be prepared for this facility, will be activated in a way that people can start making their appointments. The clinic will run from 9 to 11:30 and from 1 to 3 o'clock, so those appointments will be made during that time. The length of time in this facility will be longer than that because as part of the vaccination effort, there'll be an assessment and education that takes place, and then there'll be a vaccination, and then really an observation time of 15 minutes. So any individual should expect about 30 to 35 minutes time that they would be here. But that's really our approach with this limited amount of vaccine we have.
Just to follow up on that, people can register through a website that's going to be unveiled soon by you guys? Like with by
Yes,
tomorrow?
just to clarify, I will be sending a press release out tonight.
And then you said as far as this clinic's opening hours, you mentioned 9 to 11:30.
Yeah.
Is that in the morning, that 2.5 hour span is when you're actually giving the vaccinations out each day, Monday through Friday? Is that what you're talking about?
No, Tuesday, Wednesday, Thursday next week. Due to the limited vaccine, we're limiting it to Tuesday, Wednesday, Thursday, 9 to 11:30, and then again 1 to 3 o'clock. And what that allows us to do is to make sure that we have that time for observation, and the staff that are working this clinic, which is a lot of people. And I neglected to mention Nancy from Menasha Health Department. It's all hands on deck. Every health department is contributing this, every healthcare and partner that we've mentioned here today. It takes a lot more people than just the vaccinators to make this happen. It's so those people need a break, and that'll happen during that noon hour time frame.
Do you know how many people will be vaccinated per day in that time frame?
Yes, we'll have 333 approximately each of those days to reach that 1,000. So there'll be a limited number of appointments that they can choose from on those 3 days of options.
333 people each day to receive the vaccine. And do you know how many days this clinic will be open for?
Yes, Tuesday, Wednesday, and Thursday, but what we have to plan for is the vaccine availability. So as we scale up, we have the ability to add more days, we have the ability to add more hours, and that'll be determined primarily due to the process of the state and the vaccine availability. We have to plan that on a weekly basis.
So you don't know past this next week how many weeks we're talking?
We have some working assumptions, but it's dependent on the vaccine.
But you don't know if it's 2 weeks, 3 weeks, 4?
We're working under the assumption we'll go forward every week until we don't have vaccine to do so. We want the vaccine to be the limiting factor. I'm sorry, I have difficulty hearing you.
What would you suggest that people do who are in the eligible group but don't have a computer to register online?
Yeah, great questions. People that don't have access to a computer, we're hoping that they can reach out to family members or friends that might be able to help them through that process. We've alerted the health departments in the 3-county area that this process will take place. That would be another opportunity. It's frustrating for us too, but it's likely that those limited slots are going to fill very quickly. And we should anticipate people would be disappointed, and that we're disappointed. But that's the reality, and we have to focus on the positive. This is the start of a long process. This will take months, but we're excited. I mean, it's picking up additional people that are already being vaccinated in the clinical settings, as you've heard. So the more we can do, the better as a community will be.
Kirk, do you have to be a resident of one of those 3 counties? So somebody from Brown County or Wapaka can't just come over here and
Yeah, great question. We're really focusing and hoping people would be from the Tri-County area, but we're not going to restrict people. We know that in Green Bay, their clinic, they're getting people from Milwaukee, and we're discouraging that. But this is a federal asset from taxpayer dollars, and we respect that. So we're really prioritizing people and hoping that people in the Tri-County area avail themselves of this.
Will it be Moderna and Pfizer or one or the other? And then how will you guys handle the second dose?
Yeah, for the first week to next week, it'll be Pfizer that we're preparing for, and likely in the near future. But as new vaccines or other vaccines become available, we're going to be ready to make those adjustments.
And how are you guys handling giving out the second dose? Will they receive the second dose?
Yeah, great question. So as you know, all the vaccines available today require a 2-dose regimen, and so when they make that appointment, their second date will be published on that same ticket. And so it'll be 3 weeks from that original date that they select. So it's easy to remember, and we'll have reminders at the clinic as they leave and throughout the clinic to remind them that date that they're to return.
Once the appointment is made, what should people bring with them? Do they have to bring with them, and is there for the vaccine?
What to bring with them and what else?
Is there a cost to the vaccine?
Oh, good questions. Thank you for that. The question was, what should they bring with them, and is there any cost? No, this is this is free. And again, we can't thank the partners enough. This is something that we're coming together, recognizing the need, and the vaccine is provided to us by taxpayer dollars, so there'll be no cost. We're really asking people to come, we should talk a little bit, prepared to get a vaccine, right? So wear comfortable clothing that they can expose their arm, and we will be having a formal sign-in period, so they'll have their name already pre-prepared. So we really discourage and will turn people away that don't have an appointment. This will not be a walk-in opportunity, and so it's really important that the people that have the appointments will be provided the vaccine.
Is there going to be a 15-minute monitoring period after just to check for adverse reactions?
Is there going to, I'm sorry.
Monitoring period.
Oh, yes, that's the observation period. What that requires is, so after the vaccine, it's suggested, and we follow the protocol of having people sit, and you'll see this room in momentarily, where they'll be observed. And we're fortunate to have our firefighters, EMS, that will be in that room observing. We have protocols with Gold Cross established. So it's important that we follow those protocols. We want this clinic to be extremely safe and effective. We won't compromise quality and safety over speed.
Can you just walk them through the process of a person coming in through the door?
Yeah, Shane had suggested maybe I walk through the process so when you see the room. So there'll be a registration when they come in off the Elm Street entrance. They'll be, as we talked about, signing their name and making sure their appointment time is accurate. They'll come down the escalator as you did. They'll go into ballroom A, and they'll have the opportunity to get their consent forms. There'll be professionals there to go through any vaccine history and other questions related to adverse effects of previous vaccines. Then they'll have an opportunity, if they have specific questions, to talk with public health nurses at that point to answer any remaining questions. Then they'll go into the vaccination area. And again, we have a team representative of private clinics as well as public health nurses that will actually provide the vaccine. We have a separate team that's constituting the vaccine. And then they'll go into that observation area that we just discussed.
Kurt, I just want to ask one more question, because a lot of viewers are watching this or asking this question. Again, on that website that you mentioned, they want to know what that website's going to be, and I know you said you haven't put it out yet, and how soon it's going to be online, that they can go to that website and sign up. You know the exact time and that website.
Yeah, I think we've anticipated that question. Shane has a follow-up press release that she'll be providing each of you as a conclusion of today.
And then who is it that'll be administering the vaccine, data care and Ascension? I'm assuming, and is it a mix of students or just other healthcare workers?
Yeah, so for next week, we have public health, we have representatives from Theta Care, we have representatives from Kokona Clinic, we have the forgive me if I'm forgetting others. I think those are the vaccinators, but then we have public health people from other departments. We have volunteers from Mosaic. We have volunteers from a variety of sources that will help in those less skill set. So we call them runners, but they're going to help people. We're going to have a concierge service for those that have mobility issues that will help throughout the process. And so we're really trying to make this a safe, friendly, and welcoming environment. And so we probably are overstaffing a little bit next week, but those are training opportunities that as we grow, we're going to have that experience and confidence to go forward.
Any other questions? All right, if we don't have any other questions from the media, then feel free to take a break. Feel free to schedule a breakout interview with any of the speakers that presented tonight. And shortly, we will be opening the doors so you can go in and get some video and photos of the clinic. Thank you.